Thank you so much, Megan, for that introduction and for the honor of joining you at this event celebrating the 25th anniversary of the Supreme Court's decision in Olmstead versus LC. Let me start with a brief visual description. I'm a middle-aged white woman with curly brown hair, wearing a black suit with a flowered blouse. And I'm in my office with flags behind me and some posters on the wall, and my pronouns are she, her. 25 years ago, the Supreme Court made clear that people with disabilities have a civil right to live and fully participate in their communities. The decision poignantly talks about the harms segregating disabled people from society cause. Segregation devalues and stigmatizes people with disabilities, perpetuating unwarranted assumptions that people with disabilities cannot or are not worthy of being part of their communities. Separating disabled people from broader society deprives them of the many things everyone takes for granted in their lives. Things like being part of their family, having friends, working, going to school, and participating in community activities. And although the Supreme Court's words were written a quarter century ago, they still ring true. I've spent my life, both personally and professionally, fighting to make the promise of Olmstead real. All of us have seen firsthand the changes in the lives of people when they are given the opportunity and the supports they need to live the lives they want in the community. And I've seen how much richer our communities are when everyone is part of them. For anyone who is lucky enough to know Lois Curtis, you know that she and Elaine not only transformed the law and impacted millions of people across the country, but that Lois became an incredible artist and a valued member of her community in my home state of Georgia. But 25 years after the Supreme Court's ruling, there are still far too many people who could and want to live in the community, but can't because of a lack of access to the community services they need to do so. The Olmstead decision was not the immediate sea change that so many of us had hoped. The work of systems change is long and hard, taking a combination of legal and policy advocacy. But over time, we have made important progress because of the partnership between the disability community and the federal government. After the Olmstead decision, disability advocates like the Bazelon Center and the Protection and Advocacy Network that's funded by ACL began developing legal theories to expand the reach of the Olmstead decision, going from a focus on state-funded institutions to a wide range of privately funded institutions, and then to segregated day and educational settings. These legal scholars and incredible litigators applied these cases to a whole range of adults and children with disabilities. And as a baby lawyer at the Bazelon Center, I was so fortunate to be part of shaping the early Olmstead landscape. When the Obama Department of Justice identified Olmstead as an enforcement priority, they came to where the experience was. They recruited Olmstead litigators from the disability advocacy community. And I was so privileged to join DOJ as their special counsel on Olmstead enforcement, along with former Bazelon board member and current HHS General Counsel, Sam Bagenstos. The strategic partnerships in Olmstead enforcement that began at that time, partnering between Olmstead litigators in the disability community and the federal government, and that have continued, have been so impactful. Disability advocates know best the issues on the ground and are key partners in helping shape cases and implementing change. And when that's combined with the power of the federal government's enforcement authority, the results are truly unparalleled. But that public-private partnership has not been limited just to legal advocacy. Again, all of you who are participating today have been part of a partnership working with federal agencies to expand access to the community services that help people live, work, and participate in the community. things like home and community-based services, ACT teams, crisis services, and supported housing. The federal agency that I lead, the Administration for Community Living, is in many ways an outgrowth of the Olmstead decision. Our mission is exactly that of the Olmstead decision, to ensure that all people, regardless of type of disability, age, level of support need, have the opportunity to live and fully participate in all aspects of life. And we work to make the promise of Olmstead a reality through the work of our disability and aging networks, our partnerships with other federal agencies and states, and our role as the advisor to the HHS Secretary on disability and aging policy. And it has truly been the privilege of a lifetime to work for a president and a secretary who has been so committed to ensuring that people with disabilities of all ages can access the supports they need to be valued community members. I joined the Biden administration on day one at the height of the COVID-19 pandemic. Disabled people and institutions were at highest risk of COVID infections and death, making up the vast majority of deaths early in the pandemic. People with disabilities were being denied life-saving treatment, told their lives were less valuable than those of non-disabled people. And people with disabilities in the community were losing access to critical services, becoming isolated and often at risk of institutionalization. And that's why we quickly decided that an absolute must-do for HHS was to update our regulations implementing Section 504 of the Rehabilitation Act to make clear that these types of actions are illegal. ACL was so pleased to partner with HHS's Office for Civil Rights, working together with HHS's General Counsel, Sam Bagenstos again, in this important effort. I am so proud that last month, HHS released the first comprehensive update to the 504 regulations in almost 50 years. These new regulations cover a wide range of issues, from discrimination in medical treatment to accessibility of medical equipment, websites, apps, and kiosks, to discrimination in child welfare systems. Relevant to today's celebration, the HHS regulations incorporate the 25 years of case law and sub-regulatory guidance interpreting Olmstead. The regulations make clear that Olmstead applies to all types of segregation, residential, day, educational, to people with all types of disabilities of all ages, and to people both experiencing and at serious risk of segregation. The regulations make clear that federal funding, particularly Medicaid, can help states meet their Olmstead obligations. And our partners at the Centers for Medicare and Medicaid Services are working closely with states to help them take advantage of the many Medicaid options for expanding community services. The next panel is focused on Olmstead and children with disabilities. And as I know that you'll hear from them, too many children with disabilities end up in segregated settings as a result of involvement with the child welfare system. The new 504 regulations prohibit discrimination by child welfare systems and specifically require them to provide services to children with disabilities in the most integrated setting appropriate to their needs, which almost always is their own home or family home when they can't live with their own family. Bazelon has been at the forefront of this intersection of Olmstead and child welfare in cases like KDA and JK, cases I was able to work on during my time, and I'm so excited to see from my current perch how Bazelon and others leverage these new HHS regulations. At HHS, we've complemented our work on the Section 504 regulations with efforts to expand access to community services. The administration has invested more than $37 billion in expanding a wide range of community services, including behavioral health services, as a result of the American Rescue Plan. And this has complemented billions of dollars of new investments in behavioral health supports, including funding for 988 and a range of community-based crisis services. ACO was pleased to work with CMS on the development of the Medicaid Access Rule, also released this spring. It is the most consequential regulation expanding access to community services in more than a decade, with provisions to strengthen the direct care workforce, ensure timely access to service, and improve the quality of services, among other things. We also know that affordable, accessible housing is a critical component of community living, and that's why we've launched and are leading a partnership across HHS and HUD called the Housing and Services Resource Center to build partnerships between Medicaid, housing, disability, aging, and behavioral health agencies and stakeholders to coordinate services and housing that people with disabilities need to remain in the community. We're also focused on strengthening the direct care workforce through our new Direct Care Workforce Strategies Center. These are just a few of the highlights of the many ways that the Biden administration and HHS are working to make the promise of Olmstead a reality. As I look ahead, I am optimistic. We know what it takes to support people to live well in the community, and we are making progress in making those services more available. We now have additional powerful regulations that can help shape service systems, and we have strong partnerships between federal agencies and disability advocates. So, thank you to the Bazelon Center and to everyone listening in for all you have done and continue to do. Together, we will not rest until the full promise of Olmstead is realized. Thank you.